I believe that everybody has a right to live a healthy life. And what I see in our society is that not everybody gets that opportunity. And I want to give you
Meet Julia Kaplan. Obviously passionate about her work in public health, Kaplan says the reason opportunity doesn't knock on every door is rooted in the social determinants of health. Social determinants of health are the conditions in which people live, learn, work, and play. The choices people make are often shaped by the choices they have. The lack of choices can be detrimental to population health.
I just am infuriated by the injustices that I see, that children who live a few miles apart in different zip codes could have a 15-year difference in their life expectancy just because of the environments that they're born into. I'm outraged by that, and what I see in terms of the health outcomes for our children and for the people that I see around me in my own city.
So who is Julia Kaplan, and why should you care about what upsets her?
Julia is the project lead for the Health and Health Policies Task Force, which is a collaborative project between the Public Health Institute, the California Department of Public Health, and the California Strategic Growth Council. Kaplan was a fellow in the Women's Policy Institute in 2009 and 10, and received a master's degree in both public policy and public health from the University of California at Berkeley. Please join me in welcoming Julia Kaplan.
Recently, Kaplan brought her message to a group of about 150 people who, at the invitation of the Kent County Health Department, were attending a convening designed to begin building a healthy community for all. Both the agency and Kaplan are dedicated to bringing about better health outcomes to all through an initiative known as Health in All Policies.
Yeah, Health in All Policies is an approach to help us all have healthier communities where we can have better lives.
Health in All Policies is a change in the systems that determine how policy decisions are made and implemented. The goal is to ensure those decisions are beneficial to, or at least have neutral impacts on health. Health in All Policies is designed to begin to attack a grim set of health outcomes that are facing Americans disproportionately. Race, ethnicity, sexual orientation, age, gender, and disability all influence health. Identification and awareness of the differences among populations regarding health outcomes are the first steps to reduce the inequity. Kaplan says that's why the Kent County Health Department's first Health in All Policies convening is so important.
This is about bringing people together from across a wide variety of sectors. There's an important role to play for the nonprofit sector, for private businesses as well, but Health in All Policies primarily focuses on governments. Governments shape all kinds of things about our societies, our communities, our cities, and governments are responsible for a wide variety of decisions about how funding is allocated, how dollars are spent, what gets prioritized. And Health in All Policies is an opportunity to make sure that those decisions, those priorities, really have the interests of the people in mind.
As Kaplan explained to those in attendance, implementation can take many forms.
A lot of places are using Health in All Policies as an approach, and it actually looks different everywhere. It's not a prescription for how you do your work.
Health in All Policies grows itself organically into a community. Decisions, collaborations, and partnerships are made by those who live in the community. They are the ones who know best what is likely to most positively impact their own neighborhoods.
And what we're seeing in those communities is a really deep commitment to health and equity. We're seeing both capacity building happening, where the health department or others are providing training to other people within the government community on where there are opportunities to improve health outcomes through multi-sectoral collaboration. And we're also seeing real changes in how policies get implemented.
Community meetings are just the first step. To properly implement health and all policies, a cross-pollination of thoughts and ideas will have to occur among community leaders from all sectors.
Health and all policies requires everybody to learn. Yes, it requires people in transportation or planning or agriculture to learn about health. It also requires those of us in public health to learn about other people's fields.
As the health and all policies momentum continues, members of this audience want to know, can Kent County be next?
You're already doing it here in Kent County. I've also been really impressed by the boldness, the way that leadership and staff in Kent County are willing to take risks, try new approaches, innovate, experiment. I heard several presenters today, each one talking about new approaches, a very strong commitment to community engagement and making sure that the work of the county reflects the priority of its residents. And all of those ingredients mean that what happens, what comes out of this initiative has, I think, a very good chance at being successful.
The first steps to make health and all policies a reality here in Kent County have already been taken. What can you do next? The Kent County Health Department is making a number of resources available. Visit accesskent.com for more information. There you can learn more about the 5 elements of health and all policies. You can explore an online toolkit for strategies surrounding the implementation of health and all policies, and you can register to attend health equity and social justice dialogue workshops free of charge. Qualified speakers and presenters are available to any group that would like to learn more about health equity, health and all policies, or the Community Health Needs Assessment. Call 616-632-7100 to make arrangements. Together, we can make Kent County a healthier community for everyone.